Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor. Welcome, everybody, again to another episode of our show. Today, bringing you another really fascinating guest involved in creating a better tomorrow for all of us. Today, we have the honor of being joined by Ambassador Dr. Malin Grappa, who is the Swedish ambassador on antimicrobial resistance at the Ministry of Health and Social Affairs of Sweden, a role that she has held since March of 2022. Previous to this position, Dr. Grappa was the deputy head of the Department for Communicable Disease Control and Health Protection and head of the Unit for Antibiotics and Infection Control at the Public Health Agency of Sweden. There, she was responsible for a broad national coordination and international cooperation on antimicrobial resistance, as well as other healthcare-associated infections. Dr. Grappa is originally trained as a licensed pharmacist. She then went on to do her PhD in medical sciences for the Karolinska Institute, and her research and previous professional experience span a really broad field from everything from clinical microbiology to global health. Dr. Grappa has been the chair of the National Sector-Wide Coordinating Mechanism on Antibiotic Resistance, including 22 governmental agencies, as well as director of a World Health Organization Collaboration Center for Antimicrobial Resistance Containment. She was also a member of the program committee of the National Research Program on Antibiotic Resistance and council member of the National Council for Patient Safety. A lot of very important topics to get into today on a very timely matter. We're honored to have her with us today. Ambassador Dr. Malin Grappa, welcome to our show. Thank you for coming on.
Thank you so much, and thanks for inviting me. I'm looking forward to a nice conversation.
Absolutely, absolutely. And needless to say, this is a very important topic that we've been spending a lot of time on lately. I would love to really start things off, as we typically do, sort of by handing you the microphone for a little bit to talk just a little bit more about you, to introduce you to our audience. If you could take us back a little bit to everything from where you grew up, your obviously your developments of your interest in pharmacy, into medical sciences. And if you could take us, I think, up to 2006, your PhD, and I really found it interesting that you focused, the title of your dissertation was on the molecular basis for trimethoprim and sulfonamide resistance in gram-negative pathogens. And I have to say, as a licensed pharmacist myself, trained as such, I remember dispensing this old-time antibiotic back in the day that had a lot going for it in terms of its, broad spectrum, and it wasn't overly abused, and it was a combination therapy. You were thinking of this issue a couple decades ago as a problem, and based your PhD on it. Talk a little bit about those days, if you would, as well.
Definitely, yeah. It started early, my interest for AMR, really. So and I've been going back and forth into this area. Just I come back to it because it's so intriguing. There are so many aspects of AMR which I find really interesting, and I'm still learning a lot in this area. But yeah, as you say, I started. I grew up in Sweden, always had an interest for health and medicine, ended up studying pharmacy, and never really had any plans for a research career. But when I did my master thesis, which was on the topic of antibiotic resistance, That's where it really caught my attention, and all these broad perspectives on resistance. It's not only the bugs, but it's also the drugs, and it's so much also about health systems, behavior, and all these aspects, and especially also the international perspectives on AMR, which I found really interesting. So I did my master thesis on this topic. I came to the laboratory of clinical microbiology. I got a collection of clinical isolates, which I started to characterize the resistance mechanism of this collection. And so I was then working with as you say, trimethoprim resistance and sulfonamide resistance. And the resistance to these drugs were constituted by genes that formed mobile elements or cassettes that were stuck together in something which is called integrons, which is really, it's an effective mechanism in gram-negative bacteria to acquiring different types of genetic elements, very often they're resistance genes, and conferring resistance to many types of antibiotics. So, this was where I really started to dig into these mechanisms, and which also conferred them. You have co-selection, regardless of which of these antibiotics you use, you will promote resistance to so many other antibiotics at the same time. And during these projects, it was only one semester project, but then I actually found a new gene, a new trimethoprim resistance gene that wasn't known before. And my supervisor and professor, he was really excited. Professor Göran Kronwall, he is retired since many years, but still actually active in the area. So he was so excited, and all of a sudden I was sitting there as a PhD student. First I did my the practice and everything to also get my license as a pharmacist, but then I came back to the laboratory and ended up 4 years in the Karolinska Institute in this project. But what I also, and I think what also formed the basis for the rest of my interest and career in this area was that as a PhD student, at least, where I was during this time, I had such a freedom to also explore, all the other areas related to the work that I was doing. So I early got also into connection with the KI Institution for Global Health, led by Professor Hans Rosling at that time, and Professor Göran Thompson, and they were running projects on antibiotics use and resistance in Latin America.
Yep.
So I was super excited. I mean, this wasn't part of my thesis, but still, I had this freedom to really explore and learn more about all these aspects. So all of a sudden, I was sitting in the Amazon region of Peru, doing interviews with people on their health-seeking behavior, and still as a PhD student. So I think it really laid the basis for my increasing interest for AMR in global health.
Yeah, I noticed that along the way, as you just mentioned, you were studying these isolates, as you mentioned, in Peru and Bolivia, and I think India as well. And then you moved to the infection control unit per Public Health Agency Sweden, and here you then travel a bit. I mean, you're studying at home, looking at different groups of antibiotic consumption in Sweden, but then you're also quite far abroad. I mean, you're over in China looking at fecal carriage and beta lactamase producing microbes, and looking at in other provinces the overuse of antibiotics. Talk a little bit about more about your international journeys in those days, because just like I guess the rainforest one, but you met many other places as well, and you saw again this problem, not just the genes and the bugs in the lab, but trends, public health issues related to this. Tell us a little about your journeys in those days.
Mhm. Mhm. No, and as I said, I've always also been so interested by international cooperation and exchange. So this is it was a great opportunity for me, and that is actually even started before I came back to Sweden, to the Public Health Agency. I spent a few years with the Swiss Tropical and Public
Right.
Health Institute
Yeah.
um, as a consultant for the Global Fund on AIDS, tuberculosis, and malaria. And then I was partly based in Latin America, in Nicaragua, El Salvador, Guatemala, Bolivia, and also West Africa. So that also kind of lay the basis for this continued exploring and collaboration around the world. But then, as you say, when I got back to Sweden, to the Public Health Agency, and at that time actually was the Swedish Institute for Communicable Disease Control,
Okay.
which was then merged with the Public Health Institute to the new agency in 2014. But then we had ongoing collaborations with China, for example. And that was research collaboration, which was, first of all, with good funding opportunities, but also, even though at that time we also had quite good relations between Sweden and China, but there was also a certain aspect of the academic freedom that made this research collaboration really, very fruitful, and we had a lot of exchange. And as you say, again, we were both, doing studies on normal flora. We were doing studies on the use of antibiotics, both in humans and in animals. We were looking at antibiotics and resistance in the environment. So really ambitious and really broad project. And further to that, we were also collaborating with India through a memorandum of understanding between our ministers of health. And we've been also working, in the more neighboring region of the eastern, around the Baltic Sea and the Eastern European countries, for example. And all this is, of course, based in the long Swedish experience on this topic. Sweden started really early, and also quite early really got the political attention to AMR. So the Swedish stewardship program Strama, which is quite well known, it started already in 1995.
Okay.
So this was, this is why we also had all this exchange, and the Swedish experience was, requested from many parts of the world, while we, being a small country, dependent on the world around us, were really keen also to collaborate with others. And in addition to this, all these bilateral or regional collaborations that we have, we all the time also strengthen the relations and the collaboration with the WHO.
Mm-hmm.
So in 2016, we were also appointed WHO Collaborating Center to WHO. And that was after having working together with them really intensely on building the global antimicrobial resistance surveillance system, GLASS.
Talk a little bit, if you would, about the current role. As I mentioned at the beginning, you are the ambassador for antimicrobial resistance within the Ministry of Health and Social Affairs. And a couple months ago, we hosted Dr. Nordstrom on the show per his global health role at the Ministry of Foreign Affairs. Take us back a little bit to sort of the nature of the position, when it was first developed, and just a little bit about, I guess, what goes into a country creating a role like this, in the sense that, obviously, we've gone through the numbers on this is, predictions of 10 million deaths a year, no new antibiotics in the pipeline, lots of problems that we haven't developed anything new since the 80s. Clearly a problem. Why did Sweden decide, what, we need an ambassador for this particular issue? And take us back to some of that, if you would.
Well, of course, I wasn't part of the decision making.
Well, they called you.
I was asked afterwards. No, but it was. I think it's in line with what I said before, that Sweden, it's been a high priority for a long time. And regardless of government, I mean, it's really, have really broad support for the work that we do, while we are dependent on the world around us when it comes to AMR. We are in a good position. We have probably a slower increase. We still have an increase, but we have a slower increase than in many other parts of the world. We start from lower levels than many other countries. But again, Swedes we're traveling quite a lot around the world. We import food, animals, global trade and global travel. Also, I mean, it's so obvious that we live in a global world and we can't, protect ourselves. And that was, of course, even more obvious during the COVID-19 pandemic. So for Sweden, it's been important to do what we can to also influence others, to support others. And of course, having this long experience, even though we're a small country, our voice counts in this area. So it's also a way of contributing. So even though I'm based in the national work, that's the foundation of what I do. But now my remit is really only to represent Sweden in the international arena, and also, of course, in the EU, where I think we've seen quite a lot of progress lately.
And so, as you've been in these roles and leading up, obviously, to the current position, you've been publishing a lot over the years, is everything from the legal framework on antimicrobial stewardship. You published on One Health and thinking about veterinary medicine, and a lot of what you've been focusing on has recently sort of culminated in this recent policy paper, per the European Observatory, entitled "How Can the EU Support Sustainable Innovation and Access to Effective Antibiotics?" March 2023. Introduce us, if you would, first to the European Observatory. I know this is part of a major initiative, part of the World Health Organization and sort of the European region. Introduce us to that, and a little bit about how the work, let's say, that went into this particular document got put together, and then we'll go into some of the findings in a little bit.
I think it was really exciting when the reason for developing this policy brief was to use it as a basis for the high-level meeting that we planned for during our Swedish presidency of the EU Council. And we very early realized that doing a high-level meeting on AMR, it could be a little bit of everything. And for us, it was really important to have a concrete focus, to make sure that we could, really see a contribution to progress in this area. So we quite early chose to focus for the high-level meeting. We had two focus areas. We had access to antibiotics, access to new and existing antibiotics, but also the EU's role in the global arena when it comes to AMR. So that was another part. But when it comes to access, we wanted to develop this policy brief to really have a good basis for the discussions and being able to go more into depth during the meeting. We also saw, and we, of course, are quite aware that there are so many options, measures, proposals already on the table. So we also felt that this is not the time to invent something entirely new, but to have a good look on all the suggested measures that we already have. So that was like the starting point for this policy brief. And then we worked really closely together with the authors of the European Observatory of Health Systems and Policies. A great collaboration. We also had a fantastic reference group of additional external people that supported a lot from WHO and OECD and so on. So that was, I think it was a really rewarding and interesting work that we were doing in this. And then using this as a basis, I think we also during both the high level part of this meeting, but also during the expert session of the meeting, really had the chance to also develop further the options, especially for the EU level, but also what can be done at national level or sometimes maybe even global level. So it was really inspiring in many ways.
Mm-hmm. And speak a little bit to, I mean, there's a series of findings that I think it's worth talking about. Sort of the first one, which is kind of sort of the reason we all got here. And recently when we talked to Leslie Ogilvie on sort of the current state of affairs, that although we have thousands of cancer drugs and Alzheimer's drugs and everything else in development, we got less than 80 antibiotics anywhere on this planet in development. And you point out, the number one finding here. It's a science issue. It's an economic issue. It's a structural issue. It's a regulatory issue. Why we're not developing antibiotics? What are some of the core findings that you saw per the discussion points going into this paper and these findings of why we are doing this anymore?
Well, first of all, I think it's important to note that we wanted to connect all the dots. We wanted to see this, and we illustrated it also during this meeting as a circular chain. Because development of antibiotics is not it's not linear. It's not like we're going to have all the antibiotics that we need and then we're done. But we will all the time have development. As long as we use antibiotics, we will have development of resistance. We will have to make sure that we can monitor that resistance development, to make sure that we can meet identify, prioritize, and meet the public health needs. And when it comes to development, that's one part of it, but we also need to assure access. So just because you have something developed, you can really not trust also having access to this drug. And when we looked at access, we also were really keen on assuring to include all the aspects of access to the existing antibiotics. And this is, it's been a priority for Sweden for quite some time now, because we are suffering, of course, as many other countries, from the stockout situation, the fragile production and supply chain, the lack of transparency, which kind of is a barrier for containing the risks of stockouts. But we also, being a small market, also being quite successful in our stewardship program, we're not an interesting market. So when it comes to new antibiotics, we cannot trust actually having them marketed in Sweden, and we do suffer quite a lot also from withdrawals from the Swedish market of still effective existing antibiotics, and we can't afford to lose any of these tools from the toolbox. We are lacking refill of new antibiotics, and then we cannot also see the effective and still useful ones disappearing. So that was the starting point for this, to really connect all the dots, look at the different challenges along this circular chain, and together with the experts from all the member states, talk about the possible solution. And many of these solutions were, presented in this policy brief, but of course, other suggestions came up also during the discussions. And we have this illustration. I can give you the link to this illustration of all the suggested measures, because it's quite inspiring. I think it's it's a super crowded picture, and you can't really get everything out of it, but what to do with it. But it's inspiring to see how the input from the member states were so rich. But we, as I said, we were looking at this end-to-end approach. What kind of measures are needed in the early stages? What's needed, along the way towards clinical phases, supporting often quite small companies or even academic groups, and see how they can be supported also in taking these drugs into the clinical phases, but also what is needed at the later stages, because approval is not the same as actually marketing the drugs, and you still run really high risks of bankruptcies, as we have seen now several cases of. And then what the countries can do to both facilitate, but also to assure, for example, through procurement, contracts, rewarding secure supply and not only the lowest price, for example, and then all the way to the monitoring and connecting the circle.
And you're talking about some of those companies, and it was recently actually here in a local newspaper. It was going through all the antibiotic companies that have gone bankrupt in recent years, and it's kind of a sad situation. But again, in the sort of the section about reinvigorating all this, per what you were just talking about, you mentioned both the push and the pull incentives that we need, which I think is an important piece of this for people to understand that yes, we could throw billions and billions at the companies, but at the end of the day, if there's not the appropriate pull incentives, regulatory changes, the reforms on the reimbursement side, things are not, things will stall. So I think that was an important insight there. And I don't know if you had a chance to take a look at the episode we did with the Carbex folks here in the U.S., but I think that sort of that same thinking about the way they go about looking at any portfolio type of companies or investments, that they have to look at both sides of it. So I thought that was an extremely important piece of the report as well.
Yeah, and I mean, because now there's been a lot of discussions around proposals for really strong pull incentives, and of course we do need a new way of paying for development of new antibiotics. But I think also to make sure that we have the best and the most novel and innovative new antibiotics, and we don't want new versions of old drugs to which we see resistance development really quickly. We also have to make sure that we have a grip of the entire chain to make sure that we have as many candidates as possible throughout all these stages. So, I mean, from my perspective, I can't really see how a pull incentive alone, regardless of how strong it is, can really be the most effective way of supporting innovation and development of new antibiotics. So obviously push incentives, but yes, maybe we also need something additional. We sometimes look at milestone payments or rewards for entering into new phases, for example. So I think we need a combination of this, and we need a better approach to also the procurement.
You represent a major governmental body, and as just mentioned, there's other groups that are on the scene now dealing with this issue. I mentioned Carbex, but there was also the REACT program. Talk a little bit about how you as a government leader, interact? What's the role of collaborating with some of these private sector initiatives? And then, do we need something? It seems like we do, like say the Global Fund, specifically for AMR, because clearly this money's got to come from somewhere, and we got to spend a lot on this problem. What are your viewpoints on this? How can this all work together? Let's put it that way.
The $1 million question, right?
Yeah. $1 million question.
No, but I think first your first part of the question when it comes to other actors. First of all, when we talk about cross-sectoral collaboration, for example, we talk about the One Health concept, for example. We tend to kind of stay in the area of human health, veterinary medicine, food production, and environment. And of course, those are the sectors where we see a spread of resistance. And that's really important to have all these perspectives.
Right.
But when we look at the solutions, if we should really talk about the true multi-sectoral cooperation, we will need to add many other sectors. We will have to need to add trade, research, obviously, education, development cooperation, and so on and so on. And this is something that we are quite proud of in the Swedish work, that our interagency coordination group that we have in Sweden consists of 26 different governmental agencies and some additional organizations, really reflecting all these aspects. So that's, I think, it's the basis for a good cross-sectoral collaboration. Still, this is only the public sector we talk about here. So what we also need to do, as you rightly say, is of course to add academia, to add civil society and the private sector. And it's super important. If I should really highlight something that's been missing, I think it is the civil society. We don't see enough. Their voices are not heard enough, I think, in this area. And of course, it is difficult. It also connects with the narrative of AMR, the threat of AMR. We talk about it doesn't have a face, or it's a silent pandemic. It often becomes a bit too technical when we talk about it. But it is true. We don't have a patient organization of patients suffering from consequences of AMR, right? So it is a challenge. We do have some organizations, and you mentioned REACT, which is, I think, a really good example. It's an independent network with nodes in several regions, and of which one is here in Sweden. So we have had a really fruitful collaboration with REACT throughout the years. But there are many other organizations out there, and I think we have to make sure that we have them included. Of course, also private sector industry, we have to have them included, but they are probably a little bit louder than the civil society in this area. So they make themselves heard. Academia, again, professional organizations. And also, when we talk about private sector, it's not only the pharma companies, but it's also, of course, the food industry.
Right.
So I think it's interesting to see now, after the last high-level meeting on AMR in 2016, the interagency coordination group that was formed came back to the Secretary General of the UN with their recommendations in 2019.
Mm-hmm.
And they recommended for the governance of AMR, the global governance, they recommended the formation of a global leaders group, which is in place, and in which the Swedish Minister of Health and Social Affairs is a member. They also recommended to organize a platform for this multi-stakeholder cooperation. And this platform was quite recently, or it was launched about a year ago, but it's not until now that I see it's really becoming more active.
Mm-hmm.
And the constituting meeting now will be in a few weeks under FAO hosting in Rome. So I think this is going to be really interesting, starting of this true multi-sectoral cooperation. I look forward to see how this develops. Then I also want to mention, while we're talking about these recommendations and the global governance, that the third part in this structure for governance was a recommendation to also establish an independent panel of evidence for action on AMR. This panel has still not been established. This is something that we really want to see urgently in place. And I think it's extremely important to complement the other structures and to make sure that we can coordinate better the global response on AMR.
Mm-hmm. Mm-hmm. Wonderful. Speaking of, you mentioned the topic of One Health, and obviously that's an important sort of piece of the antibiotic stewardship equation, and you've published extensively on this as well. I was just wondering, as mentioned, you were originally trained as a pharmacist. I was trained as a pharmacist. Does pharmacy have any role here in terms? I mean, I was always told, you're that connection between the doctor and the patient, and if you see, whatever, you need to counsel on it. Do we have some responsibility as pharmacists in this equation when it comes to appropriate antibiotic stewardship in the community? As pharmacists are doing so much more nowadays per infectious disease, whether it's vaccines or diagnostics or whatever we're doing. I don't practice pharmacy anymore, but I see the pharmacist around the corner a lot. Anything and any interesting stories in your days in pharmacy, that'd be cool too.
Yeah, I'm not sure I have some interesting stories really on AMR. But no, I do believe that pharmacists could play a really important role. And then again, when you look at it, if you look beyond our countries with quite good access to healthcare and so on, of course, in other parts of the world, pharmacists are even more essential when it comes both to access but also to advice on treatments for infections. So I do think so. But also, for example, in Sweden, I think the pharmacists, they are a group that is, meeting the patients that have hopefully the time to explain, to talk about adherence to treatment, to not save your antibiotics for later in case you get a new infection. And I believe that this is, it's an example of a professional group that could speak more loudly about the risks of increasing resistance and what consequences it could have. So in countries like Sweden and US, yes, I believe pharmacists, both as being people meeting patients all the time, supporting with advice, but also as a professional group being more vocal, as also physicians or nurses or veterinarians, for example. And then when you look at the low and middle income countries, pharmacists are maybe even more essential to this development, as in many countries you don't have access to proper healthcare. And this is really the difficult balance between access and excess. Because if you are really strict and say that you can only get an antibiotic with a prescription unless you have access to healthcare, to health professionals that could prescribe antibiotics for you, that's an even bigger risk. It's not only about the misuse, but it's also about being able to treating severe and life-threatening infections in many countries. So it's a difficulty. And then if you want to add the, as you talked about, the One Health aspect, if you want to add the dimension of veterinary use of antibiotics, it becomes even more difficult. And then, because access to veterinarians in many countries is, of course, much much lower than access to health professionals. And of course, you want to be able to treat your sick animals, but in many countries of the world, you also have antibiotics as part of the feed, for example. Maybe
right.
About it, and that's a different story, obviously.
Absolutely. Yeah, I didn't think of that part. But yeah, you spot on. This issue evolves from many angles, so no, I appreciate you bringing that up. Um, I noticed, we just had the World Antimicrobial Resistance Congress. I'm here in Philadelphia. I noticed you spoke at it this year. Can you tell us a little bit of your trip to Philadelphia, how you enjoyed it, what you took in from the conference, and what else is, I mean, I know the next Congress is next year, but anything else coming up on the horizon for you in terms of talks, other conferences that you're going to be speaking at, other places that we can watch you, listen to you, meet you? Anything else on the calendar for 2023 as we get into 2024, please?
Well, I do think that this coming year will be quite intense in many ways. And it is a critical year. We have, in 1 year's time now, a high-level meeting on AMR in the UN General Assembly. I think that's what everybody starts to focus on now. And because of this, I think the Congress in Philadelphia was such a great opportunity to meet people, and again from all different sectors. It was, industry, was a lot of researchers, of course, but also policymakers. I think it was a great opportunity to really, talk to people, start, priming their thoughts for the upcoming negotiations on the high-level meeting for the political declaration. And in what areas we see that we have chances for more progress. So I think it was a great opportunity. And now, well, I do travel quite a lot. I'm really happy because I'm going back to the US quite soon. I was invited to a cancer leaders summit. And this is something that I really wanted to prioritize, because that's another example of how we can, increase the awareness, advocate for more urgency. The Cancer Society, I mean, they are really good. Everybody knows whether they have been, touched by cancer. Most of us have, in one way or the other, through families. Some people themselves have contracted cancer, for example. But when it comes to resistance, nobody even knows.
Right.
You know that you got an infection, and then you had a treatment, and maybe it worked and maybe it didn't. But you will never have this discussion with your physician whether the antibiotics was working, whether you had resistance to certain types of antibiotics, for example.
Sure.
So I think the Cancer Society are really good at this, and they are also themselves dependent on antibiotics.
Yeah.
Almost all cancer patients do get antibiotics to prevent and sometimes to treat infections connected with the cancer treatment. So I think it's a really, it's a good example of a group that could also support what we want to do now when we want to leverage the progress and increase the urgency on AMR. So I'm trying to prioritize as good as I can, but I'm traveling around the world a little bit right now. I also look forward to the upcoming regional committee of the WHO, where the European region will present and hopefully have their roadmap on AMR adopted. Now, this has been developed for the European region, but I believe this roadmap could definitely be very useful for countries around the world. And it's developed to be a support for countries in assessing their own situation, prioritizing the interventions and supporting the implementation of the national action plans. You know that we have almost all the countries do have national action plans. Only around 20% are actually implementing them and have budget allocations for doing so. So there's much more to do there. Then another, I think, really important process during this year is, of course, also the negotiations under WHO on global pandemic agreements, treaty or conventional, what we end up with, where I think it's also extremely important, and Sweden is really pushing for having AMR appropriately reflected in this agreement. And this is a binding agreement, while the high-level meeting and the political declaration in September next year, when it's not binding, it's hopefully a good way of leveraging and increasing activity on AMR, but to have legally binding agreements, I think it's also really important.
Definitely. It's going to be a busy couple of years for you coming up, but I'm personally glad that it's you that's doing this and thinking about these issues. And yeah, the cancer sort of AMR connection there was quite interesting, because it gets you thinking about, all the cancer drugs that started off as antibiotics that share that same space, and then obviously coming back to your PhD, the whole issue of gene mutations and cancer resistance and stuff. So I didn't think about all the similarities, but it's neat that you're going to be spreading the word there as well. So no, this is such an exciting portfolio, and I just really wish you and the team the best with it as you continue to solve these problems and spread the word about this extremely important issue. For everybody, again, that is going to be listening to this particular episode of our show across the various podcast networks or watching on our YouTube channel, again, you've been spending time with Dr. Malin Grappa, Swedish Ambassador, Antimicrobial Resistance at the Ministry of Health and Social Affairs of Sweden. Malin, I want to thank you for taking the time out of the schedule to talk to us for a little while, to discuss this issue. Obviously, thank you for everything you're doing for everyone around the world. As we like to say on our show, thanks for helping to create a better tomorrow via what you do. A really great story.
Thank you so much. It was really a pleasure participating. Thank you.